Thank you very much. Let's go to UCLA Medical Center right now. The last count I have is that there were 8 patients there. We're about to
Hi,
get
good
an
evening. My name is Amir Dan Rubin, Chief Operating Officer, UCLA Hospital System. Today, as we all know, we had a tragic incident in our community here in Los Angeles with the commuter train. We here at the UCLA Hospital System, along with our colleagues in the healthcare system in the community and our colleagues in EMS, the fire department, and the police department, all stand ready to serve our community. This evening we received 8 trauma patients here at UCLA Medical Center. That was 8 patients, 5 of whom have been to the operating room. Those arrivals were via helicopter here at our new Ronald Reagan UCLA Medical Center. Patients have been triaged, brought in quickly. Our trauma teams here ready to handle the patients. Here at UCLA, we are a Level 1 Trauma Center for both adults and a Level 1 Trauma Center at our Mattel Children's Hospital at UCLA. But this evening we received only adults here at UCLA. We have family members here who are being cared for. Our patient relations staff, our social work staff are with those family members. We have, of course, catering and other services to support the family members. And we man telephones to answer any questions for those family members. We've been only open a little under 2 months. This is one of the first major community incidents here at the new Ronald Reagan UCLA Medical Center. The facility is working extremely well. Our state-of-the-art helipads, our trauma center, and our ICUs and operating rooms are all working well. But of course, the core of what we do and the core of why we're able to serve the community is due to our great physicians and our nurses and our staff who are here standing ready to serve the community. Thank you very much.
Good evening. I'm Mark Morocco, one of the faculty in emergency medicine here at the Ronald Reagan UCLA Medical Center. And for about 3 hours tonight, the medical center was privileged to receive 8 of our friends and neighbors as patients via the Los Angeles County EMS services via helicopter. I can tell you that the coordinated care of the trauma services of the general surgery department, the emergency medicine department, departments of radiology, and our support services were able to evaluate all 8 of our friends and neighbors quickly and triage them to appropriate definitive care. I can tell you that 5 of those patients required operative management under emergent conditions, and that the range of injuries are pretty much what you would expect in this kind of accident via the mechanism. We're seeing a lot of crush injuries, a lot of orthopedic injuries, broken bones, dislocated limbs. We have been blessed tonight to have a relative paucity of injuries to people's brains. Almost all of the patients who arrived here tonight were awake and were able to speak to us and were able to help them in their trauma care. The families are now gathering here at the medical center. Our social services teams and family support teams have embraced them. We can tell you that of the 8 patients who are here tonight, we are almost certain that we will have good news for those families as the day and night wears on. If you have any additional questions, I guess we can entertain them now.
When it comes to divvying up the patients from the crash scene, I realize that you're level 1 trauma, but who decides which patients go where? Why would some come here versus USC versus how did you get the patients to that?
The on-scene commanders, who are usually a part of the Los Angeles County Fire Department, identify and triage those patients and decide which of the available trauma centers and burn centers are most appropriate for the patients. In real time, at the site of the accident, they will make decisions as which patients should be emergently transferred and to where. We really don't know much more than that there's a helicopter inbound, and we make decisions literally in the corner of the hallway as the patients come down off of the helipad. We don't really know anything beyond the fact that the patients we receive are critical patients that have injuries that we are able to treat at our Level 1 Trauma Center. We can treat... All Level 1 trauma centers are the same. We offer the ability to respond emergently to any kind of injury, whether neurosurgical orthopedic, pediatric. The only category that might require a triage to one or the other would be whether there are dedicated burn beds available at a specific institution. However, we were lucky tonight. We did not receive any of the patients who had burn injuries. The county system and the triage system was able to send them primarily to the most appropriate hospitals. Although we receive patients like this occasionally, we treat them and then we transfer them to dedicated burn centers. Tonight we did not have to do that. We have what I would describe as 3 patients who have critical injuries. They're crush-type injuries, which typically result in bleeding into the abdominal or chest cavities. Those are the patients who go immediately from the trauma room to the operating room under emergent conditions and then receive definitive care there. The simplest way to look at it is that once we find out that someone is leaking, we plug the leak and we fix the whatever broken vessel is causing them to have bleeding into their chest or abdomen. The EMS system stood us down at about 8:30 tonight. We had about 3 hours of activation. According to what we hear now, we will not be receiving any primary trauma patients from the site. There's always a chance that there's another patient out there who may have walked away who will show up, and we stand ready to treat them if they come in. No, ma'am. We have plenty of extra capacity, and we are fully open now in both terms of trauma and receiving paramedic runs.
Okay, we've been listening to a briefing from doctors and officials at UCLA Medical Center in Westwood, where 8 patients were brought in tonight. 5 of them arrived by helicopter. All required surgery. We're told that 3 of them had critical crush injuries. All were adults. And fortunately, all were awake when they arrived, and they were all able to speak to doctors. Bill Thomas is over the scene now in Chatsworth to bring us up to date on what's happening there. Bill?
Yeah, a lot of changes right now. You saw earlier with the